Good morning, Mrs. Smith. I wanted to talk to you about your husband, John. As you've probably noticed, he's currently experiencing acute confusion. I'd like to talk about ways you can approach John to communicate effectively with him.
Yes. He's really confused at the moment. It's quite unlike him. I just don't know what to do. I really want to help John as much as I can during this challenging time.
I appreciate that it's very difficult for you, but hopefully the confusion will only be short term. The first thing to keep in mind is that John is probably quite distressed about the confusion. It's important for you to stay calm when you are interacting with him. Use clear, simple language when you talk to him to avoid overstimulating him. It will also help him understand what you are saying.
I get it. I'll try to remain calm and be as patient as I can be.
Try to minimize distractions when you're talking to John. It's a good idea to take John to a quiet place that won't overstimulate him. Noisy environments can cause brain overload as it makes it more difficult for John to process what you're saying. He may become quite stressed as well.
Okay. I'll make sure I talk to him in a quiet place. Is there anything else I can do?
Give him gentle reminders about time, place, and current events to help orient him to his surroundings. You could say something like it's 10 o'clock. It's morning tea time.
That makes sense. I'll make sure to remind him where he is and what day it is. What if John becomes very upset or agitated and starts saying things that are not true? What should I do?
If that happens, it's best not to argue with him. Try to remain calm and redirect his attention to something that he finds enjoyable. This could be going for a walk or listening to music.
Okay, I'll do my best to keep him calm and distracted if he starts to feel upset.
Another thing to keep an eye on is a change in John's body language or behavior that might be signs of distress. Some examples of this are pacing up and down, fidgeting, and verbal or physical aggression.
What should I do if I notice these changes?
Remove yourself from John's surroundings straight away and let the staff on duty know that you're concerned about John's behavior. The staff are trained to de-escalate situations like this. If necessary, John may need some medication to calm him. The staff will also talk with you to try to identify any triggers that may have set off John's behavior.
All right. I'll make sure that I ask for assistance if I'm concerned about John's behavior.